Hey guys, welcome to my channel. This channel is called Talk About It. And on this channel, I want to talk about all different types of topics and events and possibly do some reviews on some shows and stuff that I've been watching lately. Well, anyway, I want to thank you once again for tuning in. And if you find this interesting, please click like and subscribe to the channel. I'll be posting videos once a week on a different topic. And if you have anything that you want me to talk about, just leave a message in the comment section. Now, let me give you a little bit of background about me. My name is Stephanie. I'm a wife and a mother, and I work in healthcare. So today we're going to talk about occupational therapy. I am a certified occupational therapy assistant. I've been working as an occupational therapy assistant for 23 years. For over 23 years, I worked in the nursing homes. I worked in early intervention for children ages birth to 3. And I've also done a little bit of work in group homes with school-age children. So I pretty much have extensive background in occupational therapy. And I wanted today talk about the professional occupational therapy and life working as an occupational therapy assistant. So, and I also want to give you some tips, some things that they don't really tell you in school that's pertinent for you if you're working as an occupational therapy assistant. First of all, let's talk about what occupational therapy is. Occupational therapy is a healthcare profession that works with people who suffer from mental, physical, sensory, or cognitive impairments. We rehabilitate them to help them maintain or regain their independence in daily occupations or activities. So basically, if someone had a stroke, we'll go in and work with them on learning how to take a bath and get dressed and eat. Something as simple as that. So that's pretty much what the professional occupational therapy is. Now, there's 2 levels in this profession. You have the occupational therapy assistant, which is a 2-year degree, and associate degree, which you can attain from a community college. And then you have the occupational therapist, which is a master level degree where you get from a university, which is, I think it's 6 years now as a master's. Okay, so some of the things that I have come across over my years of working as an occupational therapy assistant. And I just wanted to give you guys some tips just in case if someone is interested in the profession and they're thinking about going to school for occupational therapy or for the occupational therapy assistant. So either one, whichever level you decide to go at, it's a rewarding career, and I have enjoyed every minute of it. No 2 days are the same. I really, really can honestly and deeply tell you that I really enjoy doing occupational therapy. So my first tip I want you to know is that you have to be compassionate. You have to have a heart for people if you're going to work in healthcare in general. And that doesn't matter. And that's even if you're working as a maintenance person, CNA or nurse or whatever. I mean, I believe that's just some skill or whatever you have to have about you in general. If you're going to work in healthcare, you just have to be a compassionate person, because when people are sick, they rely on you. They rely on you for just about all their needs, So you have to have a heart and a love for people in order to go in and help them with things that they need, because they're calling you for any little thing. So you just got to really care about people and be willing to go out of your way to help someone. So that's tip number 1. Be compassionate and have a heart for people in general. Now, my second tip is you need good time management skills. This is something that I don't know if we talked about it in school or not. It's been so long since I've been in school, but this is something that's very important if you I work in a nursing home, and I've been working in a nursing home for a long time. So, and also too, if you work with children and early intervention and stuff like that, because you got to have good time management skills. And when I say that, like when you go to work, when I get to work in the mornings, and there's a schedule on my desk. On that desk, I have a schedule to tell me the list of patients that I need to see for that day, and it gives me their names, their room numbers, and how many minutes I need to spend with that patient that day. So you may have a list from 7 patients, a list of maybe 8 patients, a list of maybe 10 patients, 11 patients. But you need to get these things done within 8 hours. If you got a full day schedule, you have 8 hours worth of work. Now, sometimes, depends on the caseload, you might not have a full day schedule. You may have 5 hours worth of work or 6 hours worth of work. Well, whatever hours, how many hours you have, you have to be able to manage your time in order to see those patients in that amount of time that you are allotted. Because companies want you to be what they call productive. And a lot of companies, I think the productivity requirements has changed so much over the years. I think with therapists, they may have to be about 85 to 90%. And I know with assistants, we are, I want to say 90 and above percent. I think it's changed so much over the years. I couldn't tell you, but I know they expect you to be a certain product. They expect you to be productive each day when you come to work. Companies don't want you just lounging around on the clock. They don't want to pay you for that. So anyway, you get a schedule when you come in of your list of patients, how much time you need to spend with each patient. So basically, you have to pretty much organize and plan your day out within that 8 hour time that you have if you a full-time employee, whatever. So you have to make arrangement to see these patients within that amount of time that you have for that day. So with me working in a nursing home and I'm working full time, so if I get to work sometimes I come in between 7:30 or 8 or maybe sometimes 9. But anyway, you have to work around those meals. They get 2 meals a day, breakfast and lunch. And sometimes if you're late, you'll be there for dinner. You might have to work around a dinner meal. But if you working from 8 to 4 or 7 to 3, however you want to do your schedule, you want to work that day, you have to manage those patients within that time frame. And so you have to go in, you look at your schedule. So and so may have a doctor's appointment at 8 o'clock. If you want to try to see that person before they go on that appointment, or you're going to make arrangements to try to see them after that appointment. So that's why I say you need to have good time management skills. These are things that I don't think they elaborate enough on in school. My second thing I will say is you need to be a good communicator. Depending on where you work, where I work at, we have a big rehab team. There used to be 22 therapists in all, but I think we may be down to about 16 now. But anyway, you have to be able to communicate with your coworkers, your people that you work with that's on a team. You had to communicate with staff, like nursing staff, nurses, CNAs, sometimes with the doctors, management team, patients and their families. So you had to have good communication skills. People, a lot of times you approach, people want to know, like you can go to somebody's room and the daughter's there. You want to know how's mom doing in therapy. So you got to have good communication skills where you can explain to her what's going on, how mom's progressing in therapy or whatever. And sometimes maybe the nurse has concern, like they want to know how do you put this splint on their hand. So you got to be able to communicate them, teach them how to put the splint on. So once again, that's why I say you have to have good communication skills, because you're constantly talking with different people throughout your day. Like even in someone PT may be asking about this device or what time are you going to see that patient, or what's going on with the patient that was sick. Have you noticed anything going on unusual during your session? So that's why I say you always got to have good communication skills. And also you got to communicate with your therapist, your supervisor. Your occupational therapy assistant like me, you work under the therapist. So you have to communicate with that therapist, like what's going on with that patient. Is the patient making progress? They're declining. They're having issues here. Oh, I see they need help in this area. Can we add this goal? So different things like that that's constantly going on all the time. So that's why I say you have to have good communication skills. You got to be a good communicator. My other tip is computer literate. You got to know about how to use computers. Now, when I started out in this profession 23 years ago, everything was done by hand. We wrote everything down. Paper and pencil, you wrote everything down. Now, with new technology, we're doing Zoom meetings sometimes. We're on the computers. You document everything on the computers. At one point, I remember we had iPods. We went from iPods to iPads. Now, this company, we have computers, so you have to be literate with the use of computers and stuff like that, and be efficient with your documentation. That's another thing, too. When you're working for companies, what you're doing, your therapy, the therapy that you're doing, the company is reimbursed for your services that you're doing with the patient. So you have to be able to document in a way that the insurance provider feels is skill. Like they going to read your documentation. They feel like that's something that it takes a therapist to do. Then yeah, we're going to pay for it. So that means you had to be computer literate, and you had to be efficient at documenting. And you also got to be, make sure you get your documentation done on time. You know, their companies, they expect you to have your work done by the end of the day, but they don't want you to always be behind on your paperwork and stuff like that. That's not considered good. So that's why I say you have to be computer literate and able to be efficient at documentation. My next one is a team player. You got to be a team player. Like I said, the facility I work at, we have a big rehab team. So you're constantly working with different people, adjusting your schedule around. Like PT may want to see that person at 9 o'clock, and so you might need to go back at 10. Or there are times where a patient is so debilitated or they're weak and it takes two therapists. So sometimes you may want to work with someone in PT, so y'all work together to work together. You co-treat the patient. That's what we call the co-treatment. So you have to be a team player. And also, and it's not so much a part of the therapy team. You also got to be a team player within the facility, because therapy also have to work well with nursing. So you got to sometimes you may have to assist a CNA with getting somebody out of bed, or you might need for them to help you get somebody out of bed, or talk with a nurse. Can you make sure Miss So and So have her pain medicine before I do therapy? So that's why I say you have to be a team player, because it takes the whole team. Everybody needs to work together on that team for everything to run efficiently. Or with the people in the kitchen, at the same time, hey, I want to work with Miss So and So on eating today. Can I get her tray at this time? So you have to be a good team player and be willing to be part of a team in order to work in this type of environment, or work in healthcare in general, pretty much. And also another tip, which is simple, be dependable. Be dependable. If you come to work. Don't be someone that called out a lot, stuff like that. And also, in another aspect, when I say be dependable, not so much about, they want you to come to work all the time. You're trying to make money, so you need to come to work. That's number one. But number two, be dependable, because your patients want you to be dependable. If you tell somebody you're going to do something, go and do it. If I say, Miss So-and-so, I'm going to get you a cup of ice water, go and get that cup of ice water. They looking for that. So that's why I said, by be dependable, be a person of your word. Like, because the patient, they count on you. People count on you to do what you're supposed to do. So that's why I say, be dependable. And this is another tip that they don't really explain to you that well in school. But what I'm saying is, be self-sufficient in your craft or skills. And what I mean by that is, you gotta be self-sufficient in knowing what you're doing, because no one's gonna be there to watch over your shoulder to tell you, well, Stephanie, you need to work on eating with so and so. When a therapist write their evaluation and they give you that evaluation, or you look up in the computer, you're gonna see their goals. So that means you have to be self-sufficient in deciding what you're going to do to help that patient reach that goal. You have to set your treatment plans. Like when I get a new patient, I read out their evaluation, I look at their goals. And so when I go and meet the patient and I talk with them, and so I get some idea, I read the paperwork first, and I go and meet the patient and I talk with them, get some idea of like where their levels, where they at, because sometimes you read the paperwork, they may seem like they are further behind than what they are. They may seem more debilitated than what they really are. Because sometimes when a patient first come in, they are on a lot of medication coming from the hospital. They're really weak. They may be confused, And when a therapist come in, they write these goals. So and so need to work on balance issues, and they lost the balance. So this could be a new day. This person might be feeling better, may feel stronger in the morning, so they can sit up even better. So that's why I say you have to be self-sufficient to pretty much decide how you're going to carry out that treatment plan. Because no one's going to be there holding your hand, telling you, I want you to work on this, I want you to do that, I want you to do that. They write the goals and they expect you to address those goals, don't get me wrong. But as the assistant, you have to sit down and plan out how you're going to carry out those goals with that patient on your own. And so, and sometimes now you can go to the therapist sometimes if you're having like some issues or something don't seem clear in the evaluation, and they'll help you that way. They might say, well, do E-stem on this hand, help them build strength in this hand. They may give you little tips and stuff like that, but as far as when it comes down to the treatment plan, they're not there to hold you by hand and tell you what to do each day. You got to be self-sufficient in your craft and your skills and believe in yourself and that know that you're capable of doing the job. And then another thing is I got to be able to lift 50 pounds or more. Now there's lifting requirements, like especially if you're working in a nursing home, because we get people, they're debilitated, they're weak, and they can't stand up, they can't sit up on their own. So you got to be strong enough to help them transition to whatever position you're trying to put them in. If they can't stand, they're gonna need you manually to help them stand up. So that's why I say you had to have some strength or be able to lift people. If you work in like a lot of these facilities, sometimes lifting is involved. So that's something that they don't really elaborate a lot on in school. Now this is one that I find is important that I don't remember us going into in school, but I put down, be willing to be a jack of all trades. And what I mean by that, you're going to be called on to do a lot of things that's outside of what you're doing with that patient. Like sometimes so-and-so light on, they need somebody to go get them some water. Be willing to go get that person some water. Or I've learned how to work on wheelchairs. These things that we didn't learn in school. You got to learn how to put a leg rest on, know how to adjust a leg rest, or tighten a wheelchair brake, different little things. Some things you got to be willing to be a jack of all trades. You're needed to do a lot of different things. Like if the toilet clogged up, the maintenance man, he down the hall something else. You might have to unclog that toilet, so just realize you have to be adaptable if you work, especially if you're working like in a nursing home setting. That's pretty much what I'm mainly talking about, because that's the setting that I work in. You could be called on to do a lot of different things that may be outside some of the things that you normally would do as a therapist, in your profession. So I'm just saying, just be adaptable, because you may be needing to do a lot of different things. Especially now with the COVID pandemic going on, it's almost like an all hands on deck type of thing, because with people being out of work, sick and stuff, they don't have that many aides on the floor. They want you to help pass out the trays and different things like that. So just be willing to be adaptable. So I just said be willing to be a jack of all trades, because you may be needed in all different types of capacities on your job. And the last but not least, which I think they may tell you this in school, but just continue to learn. Continue to take classes. Stay up to date on your profession, your skill. Just always try to learn different. I do, like, we're required to have like 15 hours of continuing education every year. So I'm always online researching things, working with people with Alzheimer's. I taking classes on Alzheimer's, working with people with need knee replacement. I've learned stuff about working with people with knee replacement. So always just stay up on your skill. Always be willing to learn and continue to learn. Continue to engross yourself with different in different areas or of impairments and stuff like that. What I'm saying, just always be willing, even though it's required yearly that you have so many continuing education hours in order to renew your license, but still you should be willing to do this even if it's not required. Because I'm always trying to learn something new, just to stay up to breast on different techniques, like learning how to transfer people, just different things. You always want to stay up to par on your craft, your skill. So I hope you guys enjoyed. Those were just a few things that I just found pertinent as working as an occupational therapy assistant that I didn't feel like they were covered in school that much for me. But anyway, if you have any questions or any comments or anything you want to ask me, just leave a message in the comment. And once again, thank you guys for tuning in. I'll be posting videos once a week. So if you like what I'm talking about, just subscribe to the channel. And if you have any question, want me to talk about something different or something else that may interest you in this, that you may have interest in this profession of occupational therapy, just leave me a comment. And once again, thank you guys for tuning in. Thanks. Love you.